especially if it's, hypoglycemia, and that may indicate that your medications may be too strong or that you may not be eating enough. What is a normal blood sugar level? A lot of times people ask me what is a normal blood sugar level because sadly they're just told that they're diabetic or pre-diabetic without having told, okay, what is a normal blood sugar level and what we should target for. So in this video, I am going to break down what is a normal blood sugar level, both daily normal blood sugar level and an average blood sugar level. So let's get started. So for a normal blood sugar level, there are two things you want to look at. The first one is the fasting blood sugar level. So for the fasting blood sugar level, that means a blood sugar level that you take before you eat anything in the morning. Now that will be able to tell us how are the blood sugar levels in your blood without eating or without any energy source, so we can get a clear idea on how your blood sugar is in the morning. The second blood sugar that you want to look at is the post-meal blood sugar. So the post-meal blood sugar is the blood sugar you take 2 hours after eating, and that will tell us how well your body processes the food that you're eating. So for the fasting blood sugar, you want it to be under 100 or anywhere between 80 to 100 to be a normal level of your fasting blood sugar. Anything below 80 will be pretty dangerous, especially if it's hypoglycemia, and that may indicate that your medications may be too strong or that you may not be eating enough. So for the fasting blood sugar, you want it to be anywhere between 80 and 100. For your post-meal blood sugar, you want it to be under 140 to be considered a normal post-meal blood sugar level. Now, everybody processes food differently. That's why I really like to look at people's post-meal blood sugar to tell whether they're processing a food well or not. For example, some people may process brown rice really well. Some people may not. Some people may process a banana really well. Some people may not. And so the post-meal blood sugar can tell us whether your body is great at processing a food or not, especially when you're insulin resistant. So this is something that we want to look at when we're trying to look at what foods will work for you. Now let's look at an average blood sugar level. The average blood sugar level that we look at is called hemoglobin A1C. So I know that's a really long name, but let's call it HbA1c for short. So HbA1c is a red blood cell that sticks to your blood sugar in the blood, which can tell us an average of a 3-month blood sugar. So this is usually the number your doctor used to diagnose you with prediabetes or type 2 diabetes. So to be considered a normal A1C, you want it to be less than 5.7. If you're under 5.7, that means you are at the normal HbA1c level. If it's anywhere between 5.7 to 6.3, that puts you in the pre-diabetic A1C category. If it's anywhere over 6.4, that puts you in the type 2 diabetic category. And so this is the A1C that your doctor usually looks at to diagnose you with prediabetes or diabetes. Now, I don't want you to lose hope. I'm actually a dietitian that helps people reverse type 2 diabetes with plant-based eating, and one thing that I want you to know is to bring your A1C down isn't just about losing weight or exercising or cutting out carbs. A lot of times, this may not get to the root cause of the problem, which is insulin resistance. What do I mean by that? A lot of times I've heard a lot of people tell me that they try to cut out carbs and they're able to lower their A1C, but once they eat carbs again, or once they go back to a normal diet, it actually increases their A1C higher than before. Or even if it's a daily blood sugar. When people are able to cut out carbs, they actually lower their blood sugar, but once they eat carbs again, it shoots their blood sugar up again. Well, you may be like, well, Charmaine, why don't we just not eat carbs? Now, the problem with that is, first of all, it's not very sustainable. Second of all is because this is definitely something that is a symptom-focused approach. What do I mean by a symptom-focused approach? When you cut carbs, your focus is on the blood sugar, right? It's not really on what caused type 2 diabetes in the first place. What caused type 2 diabetes in the first place is insulin resistance. Insulin resistance is actually what caused your blood sugar to rise when you eat carbohydrates, because your body is not able to to use insulin effectively. That is why there's a higher blood sugar in your blood when you have type 2 diabetes. But if you're able to reverse the mechanism that caused type 2 diabetes in the first place, which is insulin resistance, then we're able to lower your blood sugar even if you're eating more carbohydrates, because we've helped your body use insulin effectively. That means we've helped your body become more insulin sensitive. So this is definitely something that is very important, and I want you to understand when it comes to lowering your blood sugar back to a normal level. People that are in my reversing diabetes program, they're able to eat way more carbohydrates than they have before, and they're still able to bring their blood sugar to a normal level, including their A1C, including their blood sugar. So it's definitely something that is doable when you focus on the root cause of type 2 diabetes. If you want to learn more about this, I have a free training where I break down the exact steps of how I help people reverse type 2 diabetes and get off diabetic medications while eating as much healthy carbohydrates as they want. So if you want to check out that training, go to the description below. This training can't be found anywhere, and it goes way more in depth than I can do in this video. So make sure you check that out, and I will see you guys there. Have a good one.